Over 1 million more doses of Pfizer's COVID-19 vaccine have arrived in the Philippines. More than 270,000 jabs were procured by the government, while some 924,000 were donated by the U.S. through the COVAX initiative. This latest shipment comes just as the Philippines ramps up its COVID vaccination drive to include the general adult population.
Ayon po sa ating vaccine cluster, meron na po tayong sapat na supply ng bakuna kontra COVID-19. Wala ang pagbabakuna sa lahat po ng adult population. Ngunit patuloy pa rin po ang panawagan ng DOH na bigyang prioridad ang ating senior citizens at mga taong may comorbidities dahil sila po ang mas vulnerable sa malalang simptomas ng COVID-19.
Inoculation among children ages 12 to 17 and with comorbidities will also begin on Friday.
Nakapagsabi na po ang vaccine cluster, they will start on October 15. Hinahanda na po lahat ng ospital na kasama dito, nakapag-orientation na po sila. Logistics are being prepared already. Kung tatanungin tayo kung handa sila as to technical capacity, yes. We have that capacity to detect and we have that capacity to manage this kind of reactions.
As of October 10th, more than 23.1 million Filipinos have been fully vaccinated against COVID. That's about 30% of the government's target population for this year.
The Philippine Food and Drug Administration sees no need for COVID-19 booster shots yet. FDA Director General Eric Domingo says his agency has found no waning effects in doses administered in the country so far, even after almost 6 months. He notes only 516 breakthrough infections were recorded out of more than 20 million fully vaccinated Filipinos. Domingo adds 90% of breakthrough cases were observed in the 18 to 29 age group. None of them had died. Breakthrough infections refer to those who get infected with COVID-19 even after completing their jabs.
Ibig sabihin, at this time, wala pa po talagang pangangailangan na magbigay ng booster dahil hindi naman tayo nakakakita pa talaga ng waning effect po ng vaccine. Dahil kung at 5th month, makita po natin na bumababa na yung kanyang protection, dapat dumadami po yung nagkakaroon ng breakthrough infection. Pero hindi pa po natin nakikita yun at this time.
The Philippines detects 411 new cases of the Delta variant. This raises the total tally of Delta variant cases in the country to almost 3,800. The country also recorded less than 100 cases each of the Alpha and Beta variants. The Philippine Health Department says the latest samples were collected from February up until last month.
The Philippines logged 8,292 new COVID infections Monday, the lowest daily tally since August 5. Of the total 2.6 million cases, nearly 99,000 are considered active. The health department also reported 36 new deaths, the lowest in about 2 months. The DOH's COVID data system has recently been encountering glitches, but it says the decline in cases in the country is not artificial, citing lower hospital occupancy rates. It also believes infections will continue to drop if the alert level 4 in Metro Manila is extended.
4 days. Looking at the projected cases by October 31, with a shorter detection to isolation time, daily cases may decrease to 1,731 cases if alert level 4 is continued, while 3,211 to 3,605 daily cases are expected if the National Capital Region is de-escalated to alert level 3. However, if detection to isolation time is again prolonged, just like what we have observed in August, daily cases may decrease to 2,195 daily cases under alert level 4, while 4,061 to 4,557 daily cases is expected if alert level 3 is imposed.
But for Malacanang, restrictions in Metro Manila may already be eased later this week. Presidential spokesperson Harry Roque says there's a high chance the capital region will be downgraded to alert level 3 after October 15th. Metro Manila has been under alert level 4 since mid-September. The COVID Interagency Task Force will meet on Thursday to decide on its next alert level status.
Ang mabuting balita po ay pagdating po sa ICU capacity, for the first time po in many months, ang Metro Manila po ay nasa moderate risk. And that is also a factor to consider in lowering the quarantine classification. Pero meron pa rin po tayong tinitignan, ito po ang 2-week ang routine cases na yung 2-week at saka yung daily, at makikita po natin na sa NCR, negative din po ito.
The Metropolitan Manila Development Authority says the 10 p.m. to 4 a.m. curfew may also be adjusted in light of the decline in COVID cases. The MMDA also set to issue a unified policy for the upcoming All Saints Day and All Souls Day.
Hopefully po talagang Merry Christmas na po tayo. Sana wala nang bagong variant na dumating.
Health professionals, including former health secretaries, are now voicing support for the probe on the allegedly overpriced and anomalous pandemic deals entered into by the Philippine government with Pharmaly Pharmaceuticals. Various groups led by the Philippine College of Physicians signed a document called A Collective Expression of Indignation and a Call to Action, which in strong words deplored the current situation in the Philippines and expressed support for the Senate Blue Ribbon Committee. In another statement, health professional organizations called on President Rodrigo Duterte not to obstruct the testimony of material witnesses to the Senate probe, for the Justice Department to conduct its own investigation, and for the Ombudsman to file the appropriate cases against those responsible for any corruption. Now, what led to this indignation and call to action? Let's talk to one of the signatories of the statements, former Health Secretary Dr. Esperanza Cabral. Dr. Cabral, good morning. Glad you could join us today.
Good morning, Mike. Good morning, Nikki.
First off, Dr. Cabral, what prompted the strongly worded statements from the medical community? The collective expression of indignation and call to action, for instance, referred to so-called leaders as, quote, brazen, avaricious, and sugapa.
Well, I think you might call this the straw that broke the camel's back. In fact, over the last 19 months or so, health professionals and allied medical professionals have seen with increasing dismay the poor COVID response that our government has towards this pandemic. And not only that, it became clear that there were questions of graft and corruption anomalies in many of the actions that our government has taken. And so when the issue of Pharmaly came and the hearings in the Senate were being prevented from getting to the truth because the president actually said that the government officials should not go there anymore. We felt that we needed to express our indignation and our frustration and anger, and we needed to say, please, enough is enough, and let's do what is right.
And Dr. Cabral, how bad is the situation on the ground from the point of view of the medical community? Because we're supposedly seeing better numbers now. There's talk of lowering to alert level 3, but where are we now? And in terms of the whole climate, the whole environment the medical community is facing under this administration?
At the moment, you are right. We are in a better place as far as the number of daily cases of COVID, as far as the number of patients who are critical. But as you know, this is something that may turn again to something that is more disastrous in the next few weeks or the next few months. So our ability to deal with COVID must be ramped up, must be scaled up, must be provided in time so that we can prevent as many deaths and as many illnesses as possible.